We're going to talk for the next hour or so about ways to stay in good physical condition, because this is an issue that is a serious challenge in the trucking industry. We are pleased to welcome in on the Newslaker line from Fort Worth, Texas, Dr. Fahmi Farah. She is a cardiologist with Bentley Heart in Fort Worth, Texas, many, many years of practice, and she is considered one of the top cardiologists in North Texas, the 2020 top doctors, according to Fort Worth Magazine. Doctor, good to chat with you.
Great to be back on the show.
Doctor, I must tell you, a couple of weeks ago, I'm in the Washington, Baltimore area, and I had did the treadmill test, and I did very well on the treadmill test. I did really, really well, and was very pleased by it. But they did do one thing. They changed, I've been on statins now for as long as I can remember. They changed the statin that I was on from a higher dose statin to a lower dose statin, but they said this particular type of statin, going from an 80 milligram dose to a 40, was actually more efficient and would give me a better result. Now, I haven't done my blood work yet because I'm still integrating this into my system, but they said that this statin does a better job and it's more efficient than the higher dose. And I thought, 80, 40, how could that be? So my question is, how could that be?
Well, it depends on which statin they had you on the first time. There are several different types of statin medications, and there are some that are high potency and some that are not. For example, if they had you on something called simvastatin or preventable, those are not as high potency as opposed to something like rosuvastatin or atorvastatin. Those are higher in terms of potency. So I don't know exactly which one they switched you from, but yes, for the ones like atorvastatin and rosuvastatin, 40 milligrams would be more effective than a higher dose of something that's less potent.
Yeah, and the doctor said that my numbers were really good, but they wanted to tighten up the ratio. They wanted to get a better ratio of the good cholesterol and bad cholesterol. Now that to me seems like we're kind of fine-tuning and sandpapering things a little bit, because my blood pressure and my everything else is like ridiculously good. It's probably actually low, but the doctor's really happy about the overall numbers. And that's something that I take real seriously, because I find that being proactive about my health is something that's very important, because it's going to extend my life. But I think that's one of the things that within our trucking community, we've got to have more drivers be more proactive. And there's things out there now to make it to know how your body's reacting. There's so much technology. We should know pretty much how we're doing.
Oh, I totally agree. There's so much we can do in terms of preventative care. And in fact, we say that 80% of heart conditions and heart diseases can be preventable if you're seen on time and if you take the the appropriate measures on time. And so the fact that you're taking a statin, you're doing regular follow-ups with your physician, making sure your blood pressure is good, your cholesterol level is under good control. For those who are diabetic, making sure that their A1C is under good control. In other words, diabetes is being under good control. All of those can go a long way in terms of preventing heart disease. So, yes, I totally support that.
Well, unfortunately, I am type 2 diabetic, and I've been type 2 diabetic for about 20 years, at least when I discovered it. And I'm not heavy. I don't drink. I don't drink. I don't believe in, I'm not an alcoholic. Don't drink at all. But somehow or other, the genetics have just caught me, and there you go. So that's something too. But I've got the freestyle sensor on the left arm. Been wearing that for about 8 years. Absolutely love it.
Yes, medicines and some of the technology we have are just so advanced now. It's fairly easy to keep your diabetes under control nowadays with the right dose and the right kind of medication. Of course, the proper diet is very important as well.
Why is it, though, that, and I don't mean to sound negative towards our friends in the trucking community, is it the lifestyle? Is it the fact that there's difficult choices on the road? Still too many of our drivers smoke cigarettes or use tobacco products to one degree or another. What can we be doing collectively better as an industry to mitigate some of these risk factors?
I think when it comes to, somebody who's driving for long distance, some of those things you've said are definitely true. I think it's many different factors that go into it. Of course, the lifestyle is a little bit more sedentary because they're driving in a sitting position for long hours, and then so the activity level is low. And when you're on the road and you're just not home, your access to healthy choices becomes, I believe, a little bit more difficult. I do think there are some challenges there, but it's not impossible. My advice would be to take frequent breaks and make sure that you incorporate exercise into your regimen, no matter where you're at. Of course, healthy options are always available. Even when you're out on the road, there's always healthier choices. For example, choose a salad or a grilled fish over a cheeseburger or pizza.
How did you become a cardiologist? And I'm reading your bio. You're a specialist in both invasive and nuclear cardiology. Pretty serious stuff. What prompted you to, at a young age, I would presume, say, you know what, I want to be a doctor, but not only do I want to be a doctor, I want to be a heart surgeon?
Well, I think it has to do with my family background. I grew up among a lot of heart patients. Heart disease runs pretty wild in my family. A lot of male figures in my dad's side, they died of heart attack at a fairly young age. So I think that definitely introduced me to the field early on. And then, when I went to medical school, I kept a pretty open mind, but of all the rotations, all the different organ system, I always kept just going back to the heart. I found it fascinating. In fact, when I was only 10 years old, I was in elementary school, and school was out one summer, and instead of just going out and having fun, I gave myself a project, which was like studying the different organ system and making a project out of it, and that was a very intriguing one because when I came to heart, I couldn't stop studying about the heart. So even at 10 years of age, I was pretty fascinated with the heart.
So that's like fourth grade then. That's your fascination sort of began like when you were an elementary school kid.
Pretty much. And, when I used to play, most people played with Barbie. I used to play with stethoscope, pretending to be a doctor and treating, my family members, just pretending. So that interest was there for a very long time.
What's that game that the old Milton Bradley game where you'd have to take the plastic tweezers and you can't touch the sides of it? I can't recall what the name of the game was, but that must have been it.
Yeah, probably. Yes, and I remember when I was in elementary school, one of my English teachers, I remember her name. Her name was Miss Wilson. I hope she's doing well still. But she gave me a gift one Christmas, and it was a stethoscope. It was like a used stethoscope from one of her family members, and she knew how badly I wanted to become a heart doctor. And that was like one of the most memorable gifts still to this day because I just cherished that stethoscope, and it just gave me so much encouragement to keep going on that path.
Do you still have it?
Unfortunately, I don't. I've moved around so much in my life. I've lost it, unfortunately.
What is the biggest problem that you think we face when it comes to cardiovascular disease? Is it lack of exercise? Is it the weight? What do you think it is?
I think it's a little bit of everything. I think when it comes to the amount of cardiovascular disease burden we have in the United States and worldwide, a large majority of it goes down to our lifestyle, and majority of that has to do with the food intake. In America, we have a very busy lifestyle. A lot of times, healthy foods can be expensive too. So most people don't have access to that kind of healthy food for, lack of better resources. So I think that contributes significantly into this disease burden. Likewise with exercise, people are so busy, and by the time they get home, they're so tired that they just don't have the stamina or the encouragement to go exercise. I think those two are the two leading reasons why our statistics are so bad, but also stress. I think stress is something we undermine quite a bit, but I don't think we should. I think it plays a huge role.
In conversation with one of the best cardiologists in the country, Dr. Fahmi Farah. She's an MD in Fort Worth, Texas, the 2020 Top Doctors by Fort Worth Magazine, recognized around the country as one of the leading cardiologists, talking about ways to keep your heart healthy. It's coming up to 3:46 Eastern Time here on Road Dog Trucking News. Dan Ronan in for Mark Willis. We'll be right back. In conversation with Dr. Fahmi Farah, MD, Fort Worth, Texas. She is with Bentley Heart in Fort Worth, Texas, and also practices, as I understand it, out of Baylor Hospital in downtown Fort Worth, cardiologist for many, many years, and talking about ways to stay healthy. You know, if you look back at pictures, photographs from let's go back to the 1940s. You did not see a lot of people in this country who were overweight. You did see a lot of people smoking, and you saw a lot of people drinking, but you did not see a lot of people who had weight problems. Now we don't see as many people who are drinking and smoking, but we see a lot more people who are overweight. So seems like we've kind of changed our risk factors here a little bit.
Oh, absolutely. Obesity is a major risk factor for coronary artery disease and all sorts of heart diseases, and it's running very high in our country right now. Obesity is a big issue in the United States, and it's definitely contributing to the bad statistics we have in terms of heart disease being the #1 killer.
And we've also changed, again, our food distribution system. We didn't have 40, 50 years ago, the prevalence of fast food restaurants, drive-ins. That was a much different society. We've made a radical change over the last 25, 30, 40 years in terms of the way we get much of our food delivered. Yes,
I think, like, you know, the fast food culture is just, it's high. You know, we are looking for convenience, and fast food makes it very convenient. And you're right, since the pandemic, it's even more accessible because it's so much easier to just order it with all the different ways, like Uber Eats or whatever it is. So I think that's definitely contributing to the obesity epidemic that we're having.
But yet we've never had more gyms open. We've never had more treadmills sold or Pelotons or whatever those things are. We've never seemed to be more focused on fitness, but yet we've never had more people who are battling weight problems or battling issues with cardiovascular issues. It seems to be a real dichotomy, isn't it?
It is. I'm glad that, you know, more awareness is there, that there are more people who are health conscious, and that's a trend now. It's a healthy trend. What I will say is, with that, it's like anybody and everybody can give advice on health. Have you noticed, like, you go to the gym, your trainer is telling you what to eat and what not to eat. It's just like, I feel like that kind of source could be problematic as well, because there are a lot of fad diets going on, and those are not necessarily heart healthy. The keto diet, I'm going to choose that one, for example. It's known to help people lose weight and gain muscle, but at the same time, it's not healthy for your heart. It'll increase your cholesterol level, which is a major risk factor for coronary artery disease. So I worry about that. Like, the awareness is there for health, but I feel that a lot of wrong people are giving advice that are not necessarily heart-healthy advice.
Okay, what about, now that you've opened up that line of questioning, doctor, what about drugs such as Ozempic, Trulicity, Mounjaro, predominantly used for diabetes care, but also being used for weight loss, expensive, but boy, I understand they work really well.
They do work, and I am in support of that. I believe that these medicines, you know, sure, they could have some side effects. Of course, they should not be taken, anybody should not be taking it without supervision of a physician, but these are very helpful drugs for weight loss, and you know, somebody can tolerate it and they can lose weight using it. By all means, they should use it, because obesity is a bigger problem and a bigger risk factor for heart disease.
So what happens if you stop using Ozempic or Trulicity? Does what happens then? Does it bounce back and all of a sudden the 50, 60 pounds you knocked off, is that going to come back because your appetite rebounds?
Very, very good question. And yes, it can. And that's why it is so important for people to understand and recognize that these medicines are not meant to be magic pills that'll just make you lose weight and keep the weight off. It's very much it has to be a synergistic, system between your habit changes of like what kind of food you're taking, exercising. So you definitely have to implement those along with these medicines and keep up with those when you get off of the medicine so that you maintain that weight loss and you don't gain it back. So in my clinic, we do have a weight loss clinic, and I have my own diet program. It's called the AIM diet, which stands for All in Moderation Diet. We're very successful with it, and part of the reason is because our focus is not just on weight loss, but also long-term maintenance of that weight loss, and that's where I think that most weight loss programs should consider that instead of just having the goal focused on losing the weight, it should be more focused on maintaining weight loss long-term.
Okay, fair enough. And has bariatric surgery, which was a big deal seemingly 10 or 15 years ago, has that sort of fallen out of favor now that we've gotten these medications that seem to be doing as good a job or better? Has it fallen out of favor?
I would have to say it has to some degree, yes. It's not to say that people are not going for bariatric surgeries. There are plenty of people who qualify for those and are still going for them. But I feel that with the advancement of these great drugs, a lot of people are able to avoid such an invasive surgery like bariatric surgery and just lose that weight. So yes, I do believe that the number of people needing to go through bariatric surgery is less, and thanks to these medications.
Are you optimistic that long-term, that when someone comes in to see you at the stage and they're having some problems of some sort, are you optimistic that in most cases you can get them either with the AIM program or with whatever type of medication, that some of these long-term problems that are 5, 10, 15, 20-year problems down the road, that you can at least slow it and improve the quality of someone's life?
I definitely think so, yes. Like with any amount of weight loss, you're going to improve quality of life significantly. Like we can't stress that point enough, how important it is to have that weight loss and how big of a change and difference it makes in somebody's life. I mean, every day I'm able to take patients off of multiple medications for blood pressure that they've been on for years in their lives. And just with 10, 15-pound weight loss, it made such a dramatic difference in their life. They're now off of medications. And so I encourage everybody to consider that weight loss can pay huge dividends into their long-term lifestyle and quality of life.
As a surgeon, as a cardiac surgeon, would you like to get to the point where surgery doesn't have to be done, that we have found a way either through medication or lifestyle changes or whatever the case may be, that surgery is the last option and the last available option that we have to face, because that's not the case now? Would you like that at some point 10, 15 years down the road to say, you know what, we don't do surgery very often, and when we do, it's really important, but otherwise we can fix you with medication and lifestyle changes?
Absolutely. And in fact, I don't think we have to wait 10, 15 years for that. We're already doing that here at Bentley Heart. Our AIM diet program, our goal with our patients is to avoid something so invasive like surgical and get them to lose that initial weight just to get them below a certain critical level. So yes, we're already doing that. Very proud of it, and I see more and more of that happening.
Doctor, fabulous conversation. I hope it is the first of many here when I'm filling in for Mark Willis on Road Dog Trucking News or any one of the other shows on SiriusXM. Great conversation and great work that you're doing in Central and North Texas. Really appreciate it.
Thank you for having me.